Hey guys, first of all, thanks for watching. I'm Ryan Zweygardt. I'm part of the critical care team, and I've been doing EMS for a little while. I've had the honor of learning from Peter Handtevy a kind of a different way of running a code. I know some of you guys know this, but it'll help give you confidence when you guys go run a code. As part of critical care team, we're also going to be teaching and doing some of these videos with Rich. So really hope you do learn something. Just stick with me 5-10 minutes. It won't be all that long, but if you guys really pay attention, it's just going to make you better medics, and that's what I want. I just want to see you guys succeed. The Handtevy system, Peter Handtevy out of Florida is a doctor. He actually came up with this. I know that there's others out there that are kind of like this, but this is to give you confidence in pediatric codes, okay? We have two systems in our brain. The first one is System 1, and that is the quick, fast, it knows no wrong. Example, everybody do 2 + 2. Well, we all know it's 4, right? You guys know it, it's quick, you don't have to think. That's System 1. It's quick, we don't worry about it, we know it, and we just keep moving on, all right? System 2 is the slow down, your brain actually has to think, try like med math, and it's like, ah, crap, right? And it just thinks, and then you start thinking about it, and you don't know what you do, and it's just a cluster. So this is what this is going to help relieve. But I'm going to show you guys kind of what I mean by System 2. I want you guys to do this quick, all right? There's a math problem, but I want you to do this quick. You should be able to do it in your head, all right? All right, so I want you to add here plus this, plus this, plus this, plus this, plus this. All right, what did you guys get? Now, if you do the math, how many of you came up with 6,666? Be honest. I'm going to tell you right now, that's not the answer. It's actually 5,666. Why did you come up with that? That's your System 1 thinking, oh, this is quick, bunch of ones, all I have to do is count how many, it's all going to add up. It didn't make a mistake. You can't find your mistake. Some of you got it, but I'm going to say 90% of you didn't. You can relate this to System 1. You're going to a code of a 30-year-old male that has been down for 2 minutes. What's your guys' drugs going to be? What's your epi going to be? Okay. What's your amiodarone going to be? What's your next dose going to be? Now, I'm going to hopefully say all you medics said 1 milligram and then 300 followed by 150. But that's an easy one, right? Now let's show you System 2. You just got called to a 9 echo involving a 5-year-old. I mean, if we're being honest, kids and coding kids are supposed to be breathing, right? And when they're not, we kind of get tense. We're like, crap, what do we do? And that's your System 2, like, oh man, I got to convert pounds to ages, and I got to get the tape out, and then I'm going to have to do this. And it makes you look befuddled. So this system, what it's going to do, it's going to give you confidence to run that code. Second of all, when you walk in, you're going to walk in like a boss, run the code, and it's going to give confidence to those parents that they're getting everything done for their child that they can get done. That's what we're about. So I keep saying about this, how do we do it? Well, it's very simple. You have your hand, you have 5 fingers. Follow it with me. All right, so if this is going to be your right hand, this is your thumb, that's going to be 1, all right? So 1, 3, 5, 7, 9. What that does is that represents the ages, okay? So 1-year-old, 3-year-old, 5-year-old, 7-year-old, 9-year-old, just off your fingers. You can count that, right? All right. So the only thing you have to know is with peds, we're going with ideal body weight in kilograms. So just because a 1-year-old is 20 kilos, that doesn't mean that's what he should be, right? He should be 10 kilos. And that's what we're going to base. All pediatrics are basically weight-based drugs. off ideal body weight. So that's what this is doing. So a 1-year-old is going to be 10 kilos. A 3-year-old should be 15 kilos. A 5-year-old is going to be 20 kilos. A 7-year-old, 25 kilos. And a 9-year-old, 30 kilos. If you have to write this down, I encourage it. Pause the video if you want, but write this down. Commit this to memory, all right? A 1-year-old ideal body weight. Okay, ideal body weight. A 1-year-old is 10 kilograms. A 3-year-old is 15 kilograms. A 5-year-old is 20. 7 is 25. 9 is 30. How does that help you? Let me explain. When you go to give epi to that 1-year-old, what's the conversion factor? Anybody? What I do is I move the decimal point over 1, so I've got 1.0. Okay? With a 3-year-old, you move the decimal point over 1.5, and same, 2.0, 2.5, 3.0. When you go into that code, as long as you remember everything is in milliliters, you can run this code very easily. For epi, don't worry about milligrams, just worry about milliliters. This works for epi. So your epi dose for a 1-year-old that's ideal body weight of 10 is going to be 1 mil. Okay? That works over here on a 3-year-old. That's going to be 1.5, 2.0, 2.5, and 3.0. That's your epi doses. How much easier is that walking in saying, hey, my baby is 5 years old and it's coded for whatever reason. Okay, I know I'm going to push 2 mils of epi, and it's that quick. How much more confidence do you have saying, I can remember that, that's easy. But Ryan, how about if I push amio? Like, that's even harder. Like, what the hell? I got a solution for that. For amio, it's the exact same. Oops. It doesn't change, guys. All you have to do is remember the dose. Remember it's in milliliters, and you guys are going to have this mastered. Again, please write it down, take a picture, a screenshot, whatever, and I hope it helps you out. If there's any other questions, feel free to contact me. Thank you guys, and have a great day. Be safe.